Welcome to the first lecture of the CHW training program here at NTCC. I'm so glad you decided to join us for this new program. We're going to learn a lot this semester, but we're going to start by just talking about the history of the CHWs and their roles and values. So evidence shows that CHWs can help improve healthcare access and outcomes, and we're going to talk many times throughout this course about all the ways in which they do that. They strengthen healthcare teams, and they enhance the quality of life for people in poor, underserved, and diverse communities. And we'll talk about all the different underserved and diverse communities within our next week's lectures. So it kind of started around the mid-1960s. There was references to CHWs in U.S. literature, and then in 1970, the American Public Health Association attempted to start an organization specifically for CHWs. In the 60s, the reason this first showed up in literature is because it was used by the World Health Organization as a way to reach Africa and some of the remote areas that were really struggling in the area of public health. And then in 2002, the American Public Health Association developed a section status to CHWs. This status allowed CHWs to be recognized for the first time as a healthcare provider. And then in 2006, the American Public Health Association recommended a definition of a CHW to the Bureau of Labor Statistics. That definition was a CHW is a frontline public health worker who's trusted member of and or has an unusually close understanding of the community served. This definition helped define that a CHW should really have in-depth personal knowledge of the population in which they're serving, which means that if you're dealing with adolescents, the best person to do that are younger people, not someone my age who's 34 years old. But I also wouldn't be good as a 34-year-old working with someone who's 85. Someone who's 85 should really have people closer to their age. CHWs have a trusting relationship. This enables the CHW to serve as a liaison or link between the health and the social service realm and the community to facilitate access to services and improve the quality and cultural competence of service delivery. And you'll watch a whole video over cultural competence in a little bit, and that will help kind of define what that means for you. And then in 2006, APHA did a BLS CHW definition, and they expanded more on the previous one. And that new definition said the CHW also builds individual and community capacity by increasing health knowledge and self-sufficiency through a range of activities such as outreach, community education, informal counseling, social support, and advocacy. And we'll talk about all the different ways to do that throughout this term. And then in 2007, the Community Health Worker National Workforce Study came up, and that was issued by HRSA, that's actually HRSA, after a 27-month research project. As a point of that study, there was a couple of things that was in there. So it discussed from 1966 to 1972 that this was the early demonstration period. It more related to anti-poverty strategies than to specific models of CHW intervention for disease prevention and health care. And then around 1973 to 1989, some special projects were funded by short-term public and private grants. There's still more of those going on even today. And this helped provide documentation of the CHW role in health promotion and in access to health services. And then in 1990 to 1998, there began to be state and federal initiatives. This was important because this brought money to supporting the CHW workforce. They did this through standardized training. In Texas, we have a standardized curriculum standardized processes to become certified, which we'll talk about on the first day of class. And then there was many bills introduced at the state and national level, but none of those had passed at that time. But then at 1999 to 2006, we started having public policy. Legislation passed at state and national levels. The first was in Michigan. The Patient Navigator Bill signed into law, and basically that bill allowed reimbursement and money to be tied to Medicaid and Medicare to reimburse for those services. And in 2003, the Institute of Medicine reported on reducing health disparities and recommended the use of CHWs. This is where we really took off in the profession. And then in 2007, under that HRSA study, there became the models of care. So the models of care were listed as follows. There was a member of care delivery team, which specific tasks were delegated to a lead provider. And then there's what we call the navigator, someone who improves access and educates consumers as the importance of the timely use of primary care. Then there was screening and health education provider, someone who provides specific health conditions, teaching self-care methods, administering basic screening instruments, and taking vital signs. And then there's that one that does outreach. They enroll and inform the patients. And then there's the organizer, one who is often a volunteer and usually regarding a specific health issue will promote or self-direct change in community development. These are the individuals you see out there targeting heart disease, AIDS, all those type of things that are specific to one population or one community. Also in the study, they had what they designed the barriers to the development of the CHW workforce. They stated that generally the occupation of the CHW has not been viewed as a career because CHWs have positions that are often short-term, low-paid, and have lack of recognition by other professionals. In order to change that, they recommended prevalence of short-term funding, necessary reliance on multiple funding sources, which has come to pass under the Affordable Care Act. In 2010, the U.S. Department of Labor assigned an occupational code to the CHW, that is 21-1094. This became important because this tied money and recognized it as a job at the workforce. And the DOL's definition, that stands for the Department of Labor, is a CHW is defined as an individual who promotes health or nutrition within the community in which the individual resides by serving as a liaison between the communities and healthcare agencies, by enhancing community residents' ability to effectively communicate with their own healthcare providers, providing guidance and social assistance to community residents, providing cultural and linguistic appropriate health or nutrition education, advocating for individual and community health, and providing referral and follow-up services or otherwise coordinating care. So let's talk about CHWs in Texas. So CHWs in Texas, we're at the prime because we were the first state to adopt legislation governing the utilization of CHWs. We're behind in other areas though, and we'll talk a little bit about that. So in 1999, we had House Bill 1864, which directed Texas Department of Health to establish a temporary committee. Now it's not the Texas Department of Health, now it's the Texas Department of State and Health Services. Close, but a little bit of a name difference now. And then in 2001, we had State Bill 751, which calls for the Health and Human Services Commission to utilize certified promotores in health outreach and education. Now you're going to hear promotor quite a bit. Promotor is the Spanish term for community health workers. The South Border was the first area in Texas to utilize community health workers, and that's how they were referred to early on. Now you'll hear them as both promotora and community health workers. And then also in 2001, there was State Bill 1051, which directed the Department of Health to develop and implement a promotor CHW training and certification program. This certification made it mandatory for all paid CHWs. You can be a CHW and be a volunteer and not be certified with the state. You cannot get paid as a CHW in Texas without being certified through the state, which means if a company wants to hire a community health worker, they cannot call them a community health worker and pay them without them being certified. In 2011, House Bill 2610 came out, which amended the Texas Health and Safety Code, Chapter 48, and made recommendations related to public and private funding sources and other funding and reimbursement issues. And this has to do with reimbursement for under insurance, which is still a hot debate in Texas because we're not quite there yet, even though the federal government is pushing for that in Texas. You know, we have a really tough political climate right now. So under the Affordable Care Act, there were some great things that came out for CHWs. The first thing was there was a lot of money out there to promote the community health workforce. This grew the opportunity for CHWs in Texas quite a bit. And over the last 5 years, there's been money pouring in all throughout Texas for people to hire CHWs, which is great for all of you guys. Once you graduate, you'll be able to find a job. The bad news is there is no funding mechanism right now in regards to reimbursement for services. That is changing, you know, and we'll talk a little bit about that, and there are opportunities for CHWs to go to Austin and promote that. There's one coming up relatively soon. And that's it for this lecture, and we'll talk a little bit more on the next lecture about the values and roles of a CHW specifically.